September is also National Cholesterol Education Month. According to the U.S. Department of Health and Human Services, it's a serious condition that affects 65 million Americans. The specialists at Florida Hospital Waterman's Heart Center educate us about cholesterol and heart disease and what it means to know your numbers.
Genetics and family history play a very large role in heart health, and what is a little bit challenging is trying to understand what part are genetics and what part are natural rearing exercises. And by that I mean there are about 10% of patients, for example, who have high cholesterol that have what we call familial hypercholesterolemia. In other words, their genes are just built such that no matter what they eat and however they exercise, they tend to have pretty high cholesterol. However, the other 90% don't. That tends to be environmental and behavioral. And it's a little bit challenging sometimes to separate those patient groups out, because we ask ourselves, when we have high cholesterol, it's easy to try to blame your family genetics, but we're usually not so honest about what we eat. And when you take groups of patients with high cholesterol, for example, who claim to have family history, you find that if you put them on a more strict cardiac diet, somehow their cholesterol magically improves. So it really is that overwhelming concept about personal responsibility and trying to understand, what the real modifiable risk factors are and what are the ones that are genetic. I think if you would have gone back 10 or 15 years ago and asked the average individual what their cholesterol was, they probably didn't know what it meant, and they certainly didn't know what it was.
The total number, which is something we look after, and ideally we want it to be less than 200 on a total number, but most important are the fractions. And when we look at the fractions, there's kind of three levels. One is the triglycerides, which is the first particle that comes from the food that we just ate and goes into the blood. And then from then go to the liver, and the liver is the one who does all the job of metabolism of the fat and then redistribute it in the body. When it's in excess, and it's in excess of the bad one, then that's when it starts getting accumulated in vessels, more commonly heart vessels, then vessels on the main arteries of the body, legs, and sometimes in the carotid arteries. And then the good cholesterol. The good one is called the HDL. In general, ideal number is an LDL less than 100. And ideally, it depends obviously your risk factors. If you're diabetic, it's less than 70. If you have prior heart disease, you want 70 or less. If you're otherwise healthy, it can be less than 130. But ideally, in general, to keep it simple, less than 100 will be optimal. And the good cholesterol, we want it above 45.
For those of us that are sort of in that age group, and I'll just define it somewhere over 40, who tend to get more regular health care, they tend to know what those numbers are, and they certainly have the availability to find out what they are. And then it becomes that individual's responsibility to act on it.
If you'd like to learn more about good cholesterol versus bad cholesterol, we've included a link to the American Heart Association on our webpage, yourhometownhealth.com. Simply click the cholesterol education story icon. There you'll also find more information about the diagnostic, surgical, and rehab services offered by Waterman Heart Center.